We just finished treatment, which took us about 15 minutes maybe. And we're going to measure. Can you see it?
Yeah, that's about 2 3/8.
2 3/8, okay. Want to come to the other side, please?
It's about 2 3/8.
2 3/8. So that's quite a significant difference.
Mm-hmm.
Is there anything else we measured on the lower extremity?
We flipped and
We
we
did.
measured it front and back.
Oh, okay. Well, what I'll do is I'll show the motion characteristics. And Mark, I don't know that if you can see this or not, but I'm not seeing this huge difference
Yeah.
in the soft tissue.
Yeah, it looks a little better.
Okay. Now you'll recall that I was able to abduct the foot. I'm just stabilizing the lower leg, so the talar curl is not constrained, neither is subtalar. And on this side, it just didn't move. But look at that.
Yeah, wow,
mobility.
that's a big difference.
Okay. So lie on your back, please.
Okay.
I also had demonstrated that there was no vertical mobility in the cuboid, and I'm filming. I'm by myself, and we're not in an ideal situation. I'm going to have to just ignore this phone. Can't shut it off because sometimes we get an important call like a client, but so be it. So here's cuboid, and cuboid distinctly has vertical mobility. That's an awful lot softer. And you'll recall there was no abduction mobility throughout the foot and ankle. Okay, and if you constrain the ankle, should you choose to, you still want to see mobility through the midfoot and through the rear foot. And you can then grab the calcaneus. Anyway, we looked at the fibular head in this position, so I will let you do that.
That's about 3/4.
Okay.
It's about the same.
Right at 3/4.
Okay. Here's what's interesting.
Yeah, because that one was higher last time, right?
Don't
was-
recall.
Okay.
I'll look at the films.
Yeah, yeah.
Okay. But I don't trust what I see in front.
Mm-hmm.
The fibular head is a bit like a fist.
Okay.
So this being your right fibular head,
Mhm.
it can rotate posteriorly, and you look at the tops and they look quite symmetrical,
Mhm.
but you look at the bottoms and this one can
Quite
be
different.
Right,
very different. I
Right.
learned that sometime about a year ago or so.
Mm-hmm.
I haven't read that anywhere. Just stumbled on that. So I trust not what I see in the front, but what I see when you're prone.
Mm-hmm.
And when you're laying supine, I don't really trust a PA spring test. I do trust a posterior to anterior, but I do like the client prone in order to test a posterior to anterior spring test. So anyway, that's the difference we made in your foot and ankle. We haven't had a chance to get you up and walking. You want to do that real quick?
Sure,
And
I'd
just
be glad
make
to.
any comments?
Yeah. Same place, just in the hall and back?
Oh yeah, oh yeah.
I don't know that I noticed anything different, but I didn't know when it was locked either. So,
Okay, all right. So in this context, in the context of you walking, you're not aware of any difference?
Mm-mm.
Okay, very good. So let's stop here. And we'll go on and then we'll film the pubic joint again, having treated it also.
Okay.